Hello, everyone, and thanks for being here. Today, we're talking about cybersecurity and the Internet of Medical Things, or IoMT, which we define as the collection of Internet-connected devices and applications in healthcare that connect patients with providers and health systems at large. I'm Dr. Rasu Shrestha, Chief Innovation Officer at University of Pittsburgh Medical Center, or UPMC, and Executive Vice President at UPMC Enterprises, a division of UPMC dedicated to reinventing healthcare through innovation, entrepreneurship, and commercialization. I'll be your moderator for today's webinar. This is the second in a two-part webinar series on IoMT, produced by the Center for Connected Medicine, an executive briefing center dedicated to thought leadership in digital health innovation and the future of patient care. The Center for Connected Medicine is jointly operated by GE Healthcare, IBM, Lenovo Health, Nokia, and UPMC. In part one of the series, which you can now view on the center's website, connectedmed.com, we had a lively discussion on IoMT technology. We discussed solutions that are connecting patients and providers and bringing value to health systems that are trying to reduce costs and improve quality. The conversation in part one provided a broad overview of the growth of IoMT devices in healthcare, dove into real-world solutions, and hashed out challenges that need to be overcome. Today, in part two of the series, we're transitioning the discussion to a particularly timely topic, cybersecurity. It seems like I read new headlines every day about the latest cyber attack targeting healthcare institutions, many of which have involved IoMT devices. Let me offer a few data points to set the stage for our discussion today. Major health data breaches rose 300% between 2014 and 2016, according to TrapX Security. It's estimated that the healthcare industry is spending more than $6 billion a year in fines and other costs related to these breaches and other cyber attacks. And the trend isn't slowing down. In the first quarter of this year, healthcare faced more cyber attacks than any other industry vertical, according to Vectra Networks. As you can see, we're in the midst of an unprecedented barrage of cybersecurity attacks. Just last month, the so-called Petya ransomware attack crippled IT systems at a range of companies, including some in the healthcare industry. So the time to take action is now. Luckily, I think the industry has recognized the challenge and is beginning to respond. In fact, here at UPMC, and I know at many other institutions too, cybersecurity is a recurring boardroom agenda item. Across the country, health system leaders are placing a greater emphasis on protecting their networks and devices from intrusion. While more attention and spending is being allocated to cybersecurity, there is more that needs to be done, which is why I'm excited to welcome a fantastic panel of healthcare cybersecurity experts to discuss this topic and provide some valuable lessons and advice. Our panelists span the healthcare cybersecurity ecosystem and carry with them a broad range of experience. Today, I'll be talking with Garrett Hall. Garrett is Research Director in Cybersecurity and Implementation Services at KLAS. KLAS provides research, insights, and solutions to help their clients select the best possible IT solutions for their needs. Garrett is co-author of a recent report titled Understanding the Healthcare Security Landscape. Great to have you here, and welcome, Garrett.
Thank you. It's a pleasure to be here.
Thanks, Garrett. We're also joined by Beth Musumeci, Vice President of Cybersecurity at GE Healthcare. Beth joined GE earlier this year and has many years of experience in cybersecurity with a range of technology firms. While GE Healthcare is a leader in a myriad of healthcare technology, many of which are in use here at UPMC, we're especially keen to speak with Beth about protecting connected devices. So welcome on board, Beth.
Thank you, Rasu. Great to be here.
And finally, we have Rob Marcin. Rob is Head of Strategy and Business Development for Security Product Unit at Nokia. Rob joined Nokia from Nakina Systems, a software security company that Nokia acquired in 2016. One area of expertise for Nokia is network communications, and Rob is going to talk with us about network security management. So glad to have you with us, Rob.
Thanks, Rasu. Pleasure to be here today.
So before we start the Q&A with our panelists, let me remind you that immediately following this webinar, our experts will join me and the Center for Connected Medicine in a tweet chat. So as you're listening, please tweet your questions to the hashtag IoMTChat. We'll look forward to continuing the dialogue in the Twitter sphere immediately following our webinar. So okay, jumping in. We're going to lead off with Garrett Hall from class. As I said, Garrett is a co-author of a recent report examining how health systems are responding to the growing threat from cyber attacks. And he's going to give us an overview of the latest developments in healthcare cybersecurity. So Garrett, your report suggested that health systems feel that they're behind the curve when it comes to cybersecurity. And of course, the recently released Healthcare Industry Cybersecurity Task Force report is in step with you on this point. So why do you think health systems feel left behind, and what role is the growth of IoMT playing in healthcare and cybersecurity?
Thank you, Rasu. It's a great question. We recently published a report where we spoke to about 170 healthcare professionals about their cybersecurity program, and only about 16% said that they felt that their security program was fully functional, and about 43% said that it was either not developed or just starting to develop. So, so they are, as a healthcare industry, we are a bit behind the times, and I think there are a number of different reasons. One is, with all the technology advancements that we've had, there have just been a lot of other priorities that have really taken the forefront, with new EMRs, with population health, some of the other really valuable and important aspects of healthcare technology. And I think that has pushed cybersecurity to the back burner a little bit. In addition, there's some trouble out there that providers report to us with finding good cybersecurity resources in healthcare. To really fill the gaps and help organizations to prepare and respond to attacks. And then, as you mentioned, the budget. We have a graphic here where about 41% of providers that we spoke to have less than 3% of their total IT budget dedicated to cybersecurity. So I think kind of on a large scale, it just has not been a priority for the board, or I should say maybe there are other priorities that have really trumped it. But the good news is that we are starting to see more of an emphasis on cybersecurity, and I think the Internet of Medical Things has really helped to push something to the forefront because of some of the attacks and because of the potential for real harm to be done through these attacks. It has really brought the issue of cybersecurity to the forefront, and we're seeing more organizations trying to get out in front of attacks and trying to prepare and be more proactive. So the bad news is we are behind, but the good news is that I think we're catching up.
Yes, Garrett, thank you. And as you said, healthcare IT leaders have had other priorities, and at the same time, the threats also appear to be changing as hackers adapt to new security measures. How are cyber attacks against the healthcare industry evolving, and what can providers do to prepare?
Rasu, they are evolving always. We're seeing new attacks, different approaches. One of the things that really has come out in the research is that those who feel that they are in a good place with their security program are the ones that do an annual external risk assessment, where they'll bring someone in to really identify gaps and weaknesses. And it's important to do that annually because of the evolving threats that are out there, and in order to stay on top of things. And so we see a lot of the organizations doing risk assessments. There's still a gap there where some providers say they've never done a risk assessment, and some say they do them every couple of years. So there's still a gap, but we are seeing that one of the most important ways to prepare and to try to stay ahead of the evolving attacks is to do a risk assessment and understand those gaps, and then take that and really build a security program or a security plan that will allow you to take proactive steps to prepare for and detect and then respond to attacks, rather than just wait for something to happen and then react to it. And so I think with just the evolution of attacks and with the valuable nature of healthcare information, these attacks are not going to go away, and they're going to continue to change. And so staying on top of it with just these risk assessments and with really a proactive security program and plan, I think those are really the foundation of what providers should be doing to prepare for whatever may be coming.
Absolutely, Garrett. And finally, Garrett, would you talk with us about what your research has found about specific actions being taken by the most advanced health systems to defend against cyber attacks?
Yeah, absolutely. So we actually asked this specific question in our report. We asked providers what they're doing to detect and respond to different types of attacks. The most common response in terms of detection was SIM, or Security Information and Event Management, which allows providers to really monitor the activity on their network, to understand who's on the network, what files they're accessing, and perhaps alert them to users that may be doing something that's out of the norm for them. And so this really proactive detection is something that we're seeing a lot more from the more advanced organizations, looking for anomalous behavior, and then building an incident response plan or policy, and getting an incident response team together, so that once you do detect that there is something, maybe something fishy going on the network, then you have a plan in place to really attack that and understand it and figure it out. As you can see, from there's a difference in the number of respondents that answered this question. We had 170 people that responded to the previous questions, and then only about 46 that responded to this. So not every organization that we spoke to has anything in place to detect activity on the network. And so that's a big concern. But I think those organizations that don't have something in place can really learn a lot from these more advanced organizations to make sure that they are monitoring their networks and that they've got a plan in place to respond if a red flag comes up.
Thank you, Garrett. That was really insightful. I'm glad to say that UPMC is using many of the best practices you cited, including taking a proactive approach to cybersecurity. As one of the nation's largest integrated health systems, we have 1,400 applications to manage and support. During annual system reviews, we identify vulnerabilities associated with each application, and in a typical year, we find more than 1 million vulnerabilities across our environment, which are prioritized by risk and resolved accordingly as well. In fact, UPMC identified and remediated over 3,000 instances of ransomware this last year alone. So we recognize the challenge of keeping up with the hackers. We also partner with a third-party information security provider that moves 1 billion log files through its systems each day to identify anomalies and potential threats in real time. Our Security Operations Center team investigates all high-risk anomalies that are identified through this process. So thank you again, Garrett, for your insights and for setting the stage for our dialogue today. So now let's turn our discussion to devices and talk with our expert, Beth Musumeci from GE Healthcare. Thanks again for joining us, Beth. I'm excited to tap into your experience with cybersecurity and dive into how we deal with these threats in the context of the growing use of IoMT devices in healthcare. Given GE's unique position as a manufacturer that is transforming itself into an IT-focused company, I'm sure you'll have an interesting perspective. Beth, providers are becoming increasingly dependent on internet-based resources to facilitate patient care. At UPMC alone, we have 105,000 connected devices that we manage and support. Yet the most commonly targeted equipment in the medical sector are these devices that are connected to networks, devices operating in the cloud. And the issue is that these devices have the potential to act as a gateway for breaking into hospitals' main networks. At the same time, IoMT is growing. So to start, all of the threats faced by health systems, where would you rank the vulnerability of IoMT devices, Beth? And are these threats increasing, and why?
Well, Rasu, the threat is significant. I'd like to tell you different, but it truly is. The Internet in IoT defines a broad threat context. And in the last 10 years, the Internet has matured in many ways, and that's including attacker capabilities. Public search engines for vulnerable systems like Shodan are robust and popular, and vulnerability information is rich and reaches even to free and easy-to-use attack tools. In parallel, there's no geography for the Internet and few borders. So the healthcare community does face many cybersecurity challenges today. The context of healthcare, it depends on sensitive information about patients, treatments, and often has broad availability and retention requirements, and is now more connected than ever. The IoT effect on healthcare is the result of increased connectivity with an industry-wide push for migration to electronic health records and connected health. These, by definition, increase the attack surface, and systems that were once safe offline or on paper now participate in potentially hostile networks. So just to cite some metrics, I shared a chart that illustrates the upward trends to help us better understand what we're facing. It really reinforces what Garrett's findings were in his study and also your opening remarks. Across the top are cybersecurity trends for the number of organizations impacted to the average cost of breaches just over the last couple of years. But as you pointed out, most strikingly is the rise in breaches. As you stated, breaches in healthcare have risen over 300% since 2015. So if you couple that with the rate at which we're implementing IoMT, with 60% more connected healthcare devices anticipated over the next 2 years, it's easy for us to see the challenge we have before us from a cybersecurity perspective. The transition from perimeter to device to user is a common modern pattern, and systems that have evolved quickly into a connected world are caught up in a race to cover each layer faster than the malicious packets that are right behind them. So the fact is, healthcare data is both accidental and intentional targets of attacks. I really see this in 3 categories. PHI and PII are highly attractive for data theft and fraud and can equal big money for bad actors, and are often the goal of targeted attacks, especially if it's available on ill-protected endpoints, be it provider devices, billing systems, healthcare devices. And in the case of ransomware, healthcare is especially targeted due to the need to have health record information for timely patient care, so it can translate to potentially profitable targets. However, many viruses and worms are agnostic to their targets and just so happen to impact healthcare. And then, of course, there's the hybrid situations where malware operators learn about the context by DNS of infected hosts. So this combination makes healthcare organizations, especially hospitals, common targets for ransomware and other types of attacks in recent years.
Great insights, Beth. Thank you. Now, Beth, you mentioned that security for healthcare environments is a shared responsibility between manufacturers and operators, with health systems playing the part of the operators. Can you share more about the unique challenges that health systems face and what steps hospital leaders can actually take to address these mounting threats?
Sure. There's really no one recipe, though, for securing all health systems in all environments. Healthcare environments, as you know, are very diverse. They're aimed at care first, not necessarily technology or, in fact, even security. Baseline compliance is useful in healthcare environments, but can never objectively cover the relative nature of balancing operational needs with security constraints. And it requires, in most cases, an informed staff to consciously balance this and ensure that healthcare environments operate efficiently and remain secure. Our challenge is introducing the change at a greater pace to mission-critical systems, and it is a natural challenge. Health systems, just by their nature, are slower to change. slower than many of other things in the Internet of Things. And because the purpose of health systems relate to patient and operator safety, and the development lifecycle has actually more work to be performed, verification and testing of these systems for development, as well as operation, is far more involved and complex than an enterprise laptop, say, for an accounting department. So that said, healthcare is catching up to ensure that it can run at the speed required by modern threats. But this catching up means that systems once designed for single or limited purpose and use are now evolving to be more dynamic. In our security context, this means that they become robust and adaptive to attack and are able to adapt faster and broader than ever before. The cybersecurity challenge for healthcare is not insurmountable, and overall, it's not losing the battle. Adapting a defense in-depth strategy and a constant war approach to testing, much as what Garrett was saying, can bring the organization's security posture up to a point of being able to withstand, detect, and respond to the constantly emerging threats. I'd like to think about it in 5 actions. Number 1, be sure you understand that just being compliant with regulation isn't enough. Compliance legislation such as HIPAA, HITECH, and other related regulations are guidelines to help organizations align and prioritize. However, they do not serve as prescriptive guidance to each environment, let alone each healthcare environment. Compliance doesn't necessarily equal security, and you must know what vulnerabilities exist in your environment and manage those vulnerabilities regularly and diligently. Number 2, understand that criminals will take the trouble to know your network as well as they can. Understand also that anything you accidentally connect to may accidentally get you attacked. You must know your network, and that includes to whom you allow it to connect. I think a common oversight is actually a short-sighted definition of your network. So expand the definition beyond your enterprise and employees and include third parties too. If you have suppliers, vendors, accountants connecting to your environment, make sure they're following your security policy. And that should include their suppliers too. This is a compounded effect from hospitals being incredibly connected today. Number 3, have an emergency response plan that encompasses environment continuity. Healthcare environments must prioritize critical operations when doing so, starting with ambulatory, emergency care, and then down to the less critical areas. Develop a plan and a policy to minimize the risk to the environment and practice recovery often, and that includes backups. Some health organizations back up daily, but even daily backups can be hit or miss, given the type of frequency of the data with lab results, images, health records, etc. So having an effective and tested recovery plan can prove to be a vital proactive defense. And make sure you plan for the monitored, known scenarios like ransomware, especially those that we're seeing in our environment. And given that, especially number 4, with this latest round of attacks, it's ever so important to make sure cybersecurity is part of your culture. It shouldn't just be the Chief Information Security Officer's campaign. Educate staff through awareness, training, even testing, especially phishing, which is the most common vector for ransomware. This is a commercial issue, again, not a compliance issue. And 5, most importantly, don't give up. The problem isn't as overwhelming as it may seem, but it requires executive support and budget. So make sure you have a defense in-depth approach to enterprise security that considers the array of unique devices in the healthcare environment. Likewise, ensure there's a robust incident response plan in place should the unfortunate occur, because it will, and test these response plans and the in-depth controls on a continual basis. Use experts when needed to augment your test program and your controls on a continual basis. Implementing effective program doesn't have to be hard. Putting in place a basic program proactively can save you valuable time when you might need it most, because the best defense is prevention, preparedness, and effective response. In many cases, this can mean the difference between just having a security incident, which is bad enough, versus having a major event, which can be debilitating.
Absolutely, Beth, and I'm glad you mentioned culture, and it's certainly critical for all of us to rise to the challenge as you outlined there so eloquently. So finally, Beth, as the use of IoMT devices grows, how is GE Healthcare advising the industry to manage cybersecurity?
Well, so it's many of the things we just talked about. It's practicing vigilant cybersecurity best practices, including, again, especially awareness, a clear and practiced incident response plan, not one that sits on a shelf, but one that is practiced and revised with current scenarios, but also finding a way to address an aging medical device inventory, and that's difficult and in some cases near impossible to secure. So don't be afraid to embrace new technology. The digital evolution of devices, if done properly, will enable us to develop solutions with inherent security to enable the advances of analytics, artificial intelligence, and the like. But you can't be a bystander. You must be an active participant. Security for healthcare environments is a shared responsibility between the manufacturers and operators, and it's more important now, more than ever, that operators of critical network systems partner with manufacturers to remain robust, especially on the Internet of Things. So lean forward into the development of next-generation devices and platforms with a major focus on secure by design. And this requires significant investment by manufacturers, but also means that consumers, healthcare organizations, need to be willing to retire old, insecure products for new products. Basically, everyone has to shoulder the burden of more secure models, from manufacturer to provider to consumer. The only way to get ahead of this problem is to engineer new secure platforms and deploy and operate them in a secure fashion. We spent several decades now trying to secure IT infrastructure with only modest success. And when it comes to critical OT systems like medical devices, we have to change the paradigm of security to trustworthy engineered systems from supply chain through operations. And this is the only way we will move from chasing bad and moving toward defined and demonstrated trustworthy systems that result ultimately in trustworthy data that can be used in critical operations and decision support. So again, become the change in the paradigm. Don't just be a spectator, and become part of the solution. Staying connected to forums, research, collaboration, innovation centers, coalitions, experience groups, stretching and achieving the drive, secure technical advances. Be informed, stay engaged in the process. Really, at the end of the day, Rasu, we're only as great as our collective, and we need to work together to succeed against our adversaries.
Absolutely. Well put. We're only as good as the collective. Don't stand still. Be the change. Really appreciated those words of wisdom. Thank you, Beth. I know these are major issues that we pay really close attention to at UPMC, and I'm sure at other organizations as well. To continue addressing these concerns and discuss cybersecurity at the network level, I'm pleased to welcome Rob Marcin from Nokia. Thanks again for joining us, Rob. Thanks, Rob. A robust, forward-thinking vision around network infrastructure is of paramount importance, Rob, in any modern health system. The network, we truly believe, is the spine of the entire operation. Rob, what are some of the latest risks facing health system networks?
So, I think by now the challenges are kind of well established, and Beth touched upon some of them, and these have far-reaching implications in terms of managing network security as well. So, for instance, I think even Beth touched on this, that the traditional network-centric approach to security, which primarily focuses on perimeter defenses, is no longer sufficient in today's reality. So, as a result, the conventional notion of a perimeter has disappeared, and this really started with the adoption of mobile technology and the proliferation of mobile devices like smartphones, but is going to magnify even more as IoT and medical IoT adoption increases. And so this results in a massive attack surface with an equally large number of attack vectors. And I think you said yourself that the IoT devices themselves are sometimes a launch point for attacks to other systems as well. I think we've already talked about the increasing sophistication and new types of threats and risks from situations such as ransomware and malware. And the healthcare providers, as we know, are attractive and lucrative targets for these types of attackers for many reasons. And that's only going to increase and grow over time in terms of intensity and effectiveness of attacks. In addition, I think the technology convergence that is resulting in a lot of great benefits. Technology convergence such as cloud, virtualization, the blending of information and operational technologies, great benefits, but also creating some new security considerations. And as a result, the network itself is no longer insulated from any of these attacks. It's now part of the attack surface. And so while this is happening, what we're also seeing is an increase in complexity that security teams face as they're struggling to keep pace with some of these new threats and evolution of technologies. And, simply put, I think the volume, the velocity, and the variety of security data that they have to manage is overwhelming. Some of the statistics you mentioned earlier that your organization encounters, Rasu, are quite staggering. And I'm sure your organization isn't unique in terms of facing that type of complexity. What we've seen is, on average, over 90% of companies are receiving and dealing with over 180,000 security alerts per year. And larger organizations, it's even far greater. Over 10,000 per day is probably common. So as a result, only a small portion of those, less than 30%, are actually being investigated. And what's also interesting is within that population, only a small number are actually legitimate. So there's a high degree of incorrect or false alerts. And so you have security teams spending a lot of their times investigating issues that may not actually be true issues, and spending a lot of time responding to items such as malware attacks because of faulty intelligence. So what we're seeing is there's a shift in focus from security teams from focusing solely on prevention to starting to address some of these operational challenges that I just mentioned.
Remarkable insights. Thank you. I loved your points about the massive attack surface and the increasing attack vectors and obviously the complexity associated with all of that. And some of those statistics are truly alarming. And as both Garrett and Beth mentioned, it's critical for health systems to take a proactive approach to cybersecurity on all levels. So Rob, as the network grows, as the networks actually grow in sophistication, as you alluded to earlier, what are some of the cutting-edge techniques health systems are deploying to protect against the ever-evolving threat landscape?
So, while the networks have grown in sophistication, so have some of the attack and the attack vectors. And to stay ahead of some of these threats, what we are starting to see is organizations trying to strike the right balance between proactive and reactive security best practices. And so security teams are really working hard to identify and limit attack vectors, to detect more threats, detect them faster, and respond faster. And this is really what I mean when I use the term active security. It's that right blend and balance between proactive and reactive approaches. So some of these practices involve constantly measuring your security posture and risk level. And I think, as Beth said previously, this is more than just simply auditing for compliance, but it's rather an ongoing, almost near-time assessment of your network security posture. And so, in order to do this effectively, you really need to rely on software and security software solutions that can help you automate and measure holistically your security risk and your security posture. Another best practice and emerging and growing technique is really to control and limit and monitor the access to these operational systems and assets. Right? So in addition to perimeter defenses, employing things and techniques such as access management and governance so that you can understand who and what is connecting to your networks and your systems and what are they doing in order to identify potential risks and anomalies. In order to detect these types of threats earlier in the cyber kill chain really requires an ability to perform multidimensional analysis across a variety of systems, resources, and networks as well, and be able to correlate different types of conditions and events across these different domains in order to identify risks and threats that may otherwise be missed. So here we're starting to see techniques related to machine learning and data analytics in order to identify anomalies from what is normal behavior. And it's with these analytics that you could spot indicators of compromise earlier in order to proactively and more rapidly respond and to prioritize different risks and threats. And then lastly, rapid response is key to minimize the impact of any type of cyber attack. I think all organizations and security practitioners expect that they're going to be attacked at some point. So the art is really how quickly can you detect and how quickly can you respond appropriately. And so what needs to happen is eliminate the time between detection and mitigation. And again, one of the challenges that security teams face is the inability to keep pace with just the diversity and the velocity of these attacks and threats. And I think by now it's well acknowledged that as an industry, there's simply a cyber skill set shortage. So traditional incident response strategies, which rely primarily on manual processes, now have to turn to automation. So this is where software, again, plays a key role in terms of helping you automate your incident response strategy so you could actually respond faster and deal with more of those threats. So active security, as I'm trying to show here, is really about transforming security operations to become more predictive and more automated. And so we're seeing techniques leveraging analytics, machine learning, leveraging threat intelligence in order to drive these kind of rapid and automated responses.
That's excellent. And you really eloquently talked about the right blend and balance between proactive and reactive measures, which I think is spot on. You'd also mentioned active security using machine learning to be more predictive in identifying and responding to threats. I understand that threat intelligence is a growing discipline within cybersecurity. What is it, and what advantages does it provide?
So threat intelligence is a key part of an active security architecture, and there's a few definitions, but simply put, threat intelligence is simply knowledge that helps you identify security threats in order to make informed decisions. And threat intelligence can provide information such as attacker methodologies, tools that are used, tactics, indicators of specific malware, and details of specific attack vectors. So by knowing what attackers are trying to target within your network, as well as how and why and when, it becomes it provides a lot of insight in terms of how to identify and stop and respond to these threats. And there's a variety of threat intelligence sources in the industries, and sharing of threat intelligence data within the global security community is commonplace. At Nokia, for instance, we share as well as curate our own threat intelligence data, and this helps us identify, for instance, specific threats from malware which may contribute to some of these attacks that we've talked about. But it's really when threat intelligence, in my opinion, is fused with some of these other capabilities that we were discussing, specifically with analytics and with automation or orchestration. So this allows threat intelligence, when correlated with analytics that can detect anomalies, fusing that together allows security systems to more accurately identify the different types of threats, but more importantly, what is the appropriate response strategy? And with that appropriate response, by leveraging automation, you could respond to them in a more rapid fashion. I think another key thing or aspect that's required is really contextual intelligence. So you really need to understand not only the nature of the threat, but also the nature of the service, the effective endpoints, and the associated risks, so you can initiate the appropriate automated response. So not every threat can or should be handled the same way. Having a prioritized view, understanding the consequence of a mitigation action is especially crucial And in my opinion, probably very, very crucial when you're talking about, let's say, a medical IoT device. Not every service or IoT device has sort of the same criticality in terms of the function it's performing. So it's when you combine these capabilities together, I believe, in a cohesive and in a modular way, but in a framework that's open, that allows you to integrate into different types of systems and environments, that you could really start to realize some of these new capabilities and these advantages that give you a more dynamic security operational model.
Thank you, Rob. That was great. It seems that with active security measures being adopted at both the device level and the network level, and with the proper protocol in place, health systems are able to detect and respond to emerging threats earlier than ever before. We gained some really valuable insights from all of the panelists today. But before I wrap up, I want to open up a couple of questions to the entire panel. Since we've discussed the environment and IoMT and network security, I want to talk about what's at stake. So a question for the group, just how serious are these mounting threats? And I'd love to hear what's at stake for each of our organizations. I'll start with the provider perspective. So what's at stake for UPMC can be summarized by 3 points related to our patients and the community we serve: privacy, trust, and health. There are more technical ways to talk about these 3 pillars: PHI, or protected health information, reputation, and operations. But our philosophy is to approach issues with the patient at the center of care and top of mind. So that brings us to privacy, trust, and health, critically important issues. So I'd love to hear from the rest of the group on this, and we'll start with you, Garrett. Garrett, would you like to give us some insights on this?
Yeah, Rasu, I would just echo what you just said. And at class, we're in a unique situation where we get to talk to healthcare providers each day and ask them about their situation, and ask them which software and services they're using. And I had a recent call with a provider who had just gone through an attack that really wiped them out for about a week and a half. They went back to paper, and it was a real nightmare for everyone involved. And so, there's a lot at stake here, and in terms of time, resources, money, and as you mentioned, trust, and also just the ability to care for patients. These attacks really put all of those at jeopardy, and so it's a big problem, one that needs to be addressed, and I think we're going in the right direction, but certainly it is a serious. There are serious threats out there that can really do a lot of harm.
That's well said, Garrett. And Beth, your insights on this, please.
Just echo. Basically, that there's a great deal at stake, critical info necessary to provide care to patients, functionality problems, financial impact, and I think we've heard a resounding theme that, having a practice response plan to reduce that impact is probably the best defense given the threats that are mounting against the industry at this point.
Absolutely, Beth. How about you, Rob? What are your thoughts on this?
Well, I mean, it's quite interesting in the sense that over the last few weeks and months, there's been a number of high-profile attacks that have affected healthcare organizations globally. Ransomware really started as an interesting and minor inconvenience, primarily affecting consumers, to now targeting major organizations worldwide. And this has had impacts in terms of impacting patient care, delaying surgeries, theft of personally identifiable information. And so this is all, I think this all kind of challenges some of the core attributes you mentioned, Rasu, with respect to trust, for instance. And I also think there's increasing liabilities that these new threats are going to place on healthcare providers and associated industries as well. that if they continue to evolve, if they continue to have these far-reaching impacts. But as Beth said, and I completely concur, I mean, hope is not lost, right? I think there's lots of new emerging technologies that can really assist the industry and assist providers in maintaining a strong, reliable, and robust security posture.
So absolutely agree. Let's end on a high note, shall we? Let's share opinions on what comes next for cybersecurity solutions. We're already seeing security service provider software that use machine learning and algorithms, but I believe there can and there will be more advancement in this area. I know I'm hopeful that predictive analytics can be applied to data, which will allow us one day to anticipate vulnerabilities before they occur and perhaps remediate them much faster. So how distant are these capabilities? Or are there different, more promising advancements on the horizon? Rob, why don't you start us off from a network perspective?
So Rasu, I mean, I concur with some of the technologies and some of the capabilities that you just mentioned. I don't think they are as far off as some may feel. We're already seeing the application of data science to solve all sorts of different problems, and the application of data science and the evolution of machine learning and big data analytics in the realm of cybersecurity is I think upon us, and it's with that insight that software can then be used to help automate and accelerate the response to some of these threats, and to allow security practitioners to stay ahead of the attackers.
Absolutely. Beth, what about from a device standpoint?
Well, I completely agree with Rob, and from a device standpoint, there's some excellent emerging, even imminent technologies to not only provide the analytics, but also in measures to prevent that I believe are on the horizon, and GE has made some great investments in this area so that we can predict and therefore protect. And just as we move out digitally, we'll be able to embrace the tremendous value that this will bring in our prevention and our defenses of our environments to stop bad things from impacting us. That's the goal.
Yeah, absolutely. I couldn't agree more. Predict and therefore protect. And to round us out from an industry perspective, Garrett, care to share with us some of your insights on this?
Yeah, Rasu. Again, we're in a unique position to also work with a lot of the vendors that are providing some of these great technologies, and there are some exciting technologies out there that I think really are going to help advance the industry and take us to a more secure place. We at CLASS, our job really is to validate the reality of those technologies and get the customer perspective and the customer experience with those technologies, and then report that to the industry and try to bring a little more transparency into what is really available out there and which companies are really making a difference. I would just add in the end here that as great as the technologies are, training and culture is really the key, and making sure that employees understand the policies and making sure that everybody's on the same page in terms of what is appropriate within the security program. But certainly there are some great advances, and hopefully as an industry and as we build the right culture to really make it a more secure place for healthcare providers.
Absolutely. Very well summarized there. As much as technology is critical and can be a differentiator in tackling all of this, it really boils down to training and culture. So well said. So thank you so much to our expert panel for participating in this engaging conversation today. And most of all, thank you to our viewers for tuning in. Now, please join us on Twitter for a tweet chat on cybersecurity and healthcare using the hashtag IoMT chat. So that's the Internet of Medical Things chat. I'm Dr. Rasu Shrestha. You can find me on Twitter at Rasu Shrestha, and I look forward to engaging in a rich dialogue here on Twitter shortly. Thanks very much.
All right, everybody. That was great. We are just